Hello, my name is Dr. John Cowie.
And hello, my name is Dr. Donna Judge.
And we are both dentists at Triangle Dental. Today we're going to talk about how to clean in between your teeth and why it's important. Now, a few years ago I made a video called How to Brush and Look After Your Teeth Properly. Please watch that video before you watch this one, as that teaches all the fundamentals of looking after your teeth. But if you want to take your cleaning to the next level, then carry on and watch this video. Also, if your dentist has told you that you have gum disease or that you are susceptible to gum disease, then it's essential that you do cleaning in between your teeth. So watch on to really help to prevent any gum disease from taking hold. So the reason we need to clean our teeth is to control the bacteria that naturally live in our mouths. Now, there are millions of bacteria in your mouth, in my mouth, in everyone's mouth. They're full of bacteria. But some of these bacteria are not necessarily harmful, and if we can keep them at bay, then there'll be no problems at all. These bacteria can build up right in between the teeth and right around the gum line and can become harmful. So if you start off with a really clean tooth surface, within a few hours you'll have a microscopic sticky film of plaque and bacteria that all live in little colonies together. In the first few hours they'd be microscopic, you wouldn't be able to see them. They're just a very thin film, but they stick to the teeth and they're very sticky. After a number of hours or maybe days, they can build up to be quite a thick layer, and we call this dental plaque. Now, plaque is visible. It looks white and furry, and it's very sticky. It sticks to the teeth and it's really hard to penetrate. Swishing with water, for example, can't penetrate the surface of this sticky plaque, but removing the plaque is the important thing.
Most of the bacteria in dental plaque are completely harmless, but if those bacteria are allowed to build up, it can result in tooth decay or gum disease, which we would like to obviously prevent. So it's really important that we have really good oral hygiene methods to remove these from the tooth surface. Good normal cleaning with your toothbrush, either an electric toothbrush or a manual toothbrush, for 2 minutes twice a day is very important. However, the bristles of your toothbrush are not very effective at cleaning in between your teeth. A toothbrush will only clean 3 of the 5 surfaces of a tooth. So to clean the other 2 surfaces that the bristles will not reach in between the teeth is known as interdental cleaning.
Gum disease almost always originates from areas in between the teeth. We get build-ups of plaque in between the teeth and around the gum line, and they cause the gums to become red and irritated and inflamed. And these inflamed gums bleed easily when touched. People might notice that when they're brushing. They might find blood in their toothpaste when they spit. Now, inflamed gums alone, which is something we call gingivitis, doesn't necessarily involve any lasting damage, and with good cleaning they can recover to be back to what they were before. Now, if you have gingivitis, that can progress to what we call periodontitis. Now, periodontitis is sometimes called periodontal disease, and this is what we refer to when we say gum disease. And we say gum disease because there has been some irreversible damage done. So with periodontal disease, the gums start to pull away from the tooth and we get what are called deep gum pockets. Now, in these deep gum pockets, more bacteria can amass and they irritate the gums, they irritate the bone, and they cause the gums and the bone to recede. So there is less gum holding the tooth in and less bone holding the tooth in. As gum disease progresses, we find that there's less bone holding the tooth in and the teeth can start to move around. They have less bone support, so they start to move, they start to become wobbly, and eventually these teeth are lost. We don't want to be losing teeth. Chewing food effectively is the first stage in digestion. It's the first stage in effective absorbing the nutrients that are in our food. So we want to be able to break down our food effectively in the mouth for our overall health. So we don't want to be losing teeth, and everything we can do to stop that, we want to do. Gum disease might also be associated with other health conditions that affect the whole body. I say might because researchers don't know for sure, but the bacteria found in gum disease has also been found and implicated in heart disease, blood pressure, diabetes, dementia, and pregnancy problems. And we know that these little bacteria can pass through the gums right at the join between the gum and the tooth and make their way into the bloodstream. So we don't know that gum problems cause these other health problems, but why take the risk? Let's make sure our gums stay really clean to make sure we're not risking those other health problems.
Some people are more prone to developing gum disease, and there's an awful lot of research ongoing to try to find out more than we already do. Factors such as family history, uncontrolled diabetes, and smoking are all known to be some of the factors that can increase your risk. The good news is that by good oral hygiene routine, controlling diabetes and not smoking, and also seeing your hygienist on a regular basis, all helpful in trying to prevent the progression of gum disease. The other benefit of good interdental cleaning is to try to prevent tooth decay. Some bacteria and plaque consume the sugars and carbohydrates from the food that we consume, and they produce acids which dissolve the hard enamel surface of our teeth and produce holes that need to be restored. A common place for tooth decay to occur is between the teeth, and for a dentist to be able to restore a tooth with decay in this position, they need to cut a hole in the top of the tooth. Therefore, removing the decay actually results in loss of a lot of tooth structure, which obviously isn't good for the long time life of the tooth. For a lot of people, just cleaning in between your teeth once a day is absolutely fine. We'd often say that it's best to do this before bedtime, but if this isn't happening because you're just too tired, then doing it at any time of the day is more important than not doing it at all. If you have had gum disease in the past, or if you currently have active gum disease, then it's really important that you're doing your interdental cleaning twice a day.
We like you to clean in between your teeth before you do your normal brushing with your toothbrush and toothpaste. We want the areas right in between the teeth to be clear, no food, no plaque, so that when you then do the normal brushing with toothpaste, the toothpaste can soak into those gaps and all of the good ingredients of the toothpaste can soak into the teeth, and that gives extra benefit. Don't be put off by bleeding. When you first start interdental cleaning, you'll find that some of the gums bleed. This is because there will be some areas of gums that are inflamed. Even if you can't see them, there'll be some areas where plaque is sitting next to the gum, it's inflamed, so when you start to clean it, it bleeds easily. Now, unless you're cleaning really aggressively and really strong-handedly, you're not doing any harm at all. You're actually helping. If you find an area that bleeds a little bit, well done. You've just cleaned an area that wanted to be cleaned. And after a couple of weeks of good cleaning, there'll be no plaque there and the bleeding will stop. So keep up the good cleaning and don't be put off by a little bit of bleeding. If after 2 weeks you find that your gums are still bleeding when you clean, give us a call and come and see your dentist.
It takes 2 months of doing something every day to form a habit. The techniques that we're going to show you are a new skill, and it will take some practice to get used to. Try to set yourself a goal of doing interdental cleaning every day for 2 months, and it will be easier for you then to integrate it into your daily routine.
We are now going to talk about the different methods available to clean in between the teeth. We'll tell you which ones work and which ones we'd recommend. Now, sometimes people find that they just don't get on with certain methods. So try to do the best cleaning method that we recommend. If you try that and you just can't get on with it for whatever reason, then go to one of the other methods. We'd rather that you did something rather than nothing. But there is a rank order. Some are better than others. The best way to clean in between your teeth is with interdental brushes. Now, if you have any deep gum pockets, which the dentist or hygienist will tell you, using an interspace brush down those deep pockets is also recommended as well. Flossing. Flossing is not as good at removing plaque from between your teeth as interdental brushes. However, some people have teeth that are so tight together they can't physically fit a brush in between. This is when floss is going to be the best option. Rubber toothpicks are next down on the list. Next we have water flossers. And finally, mouth rinse. Now, we don't actually recommend the routine use of mouth rinse specifically for preventing gum disease, but we'll tell you more about that in another video. This ranking brings us nicely to the end of this video, but we have individual videos on all of the techniques we've just listed. So watch the follow-up videos for more details and how to do them. Please remember that great dental health is achieved with a combination of really good home cleaning and visiting the hygienist. Now, the hygienist will clean the hard deposits that build up on teeth. You may have heard the word tartar or the word calculus. These are hardened deposits of bacteria that build up on the teeth and can't be removed with home cleaning. So the hygienist will have special instruments to remove those, and the hygienist will also be able to look at your particular teeth and advise on what size brushes might fit between certain gaps and what methods would work best for you with your home cleaning.